Hello, everybody, and welcome to Tea Talks with Terry. Today we are going to be talking about incontinence.
I'm still laughing about your comment. Okay.
She did the chop chop to me. She was like, "Oh, get on it."
Well, you did chop chop in words. I did chop chop in gestures. Okay.
So what about incontinence?
Should we start over?
No?
Okay.
He'll just edit it out.
Love it. Okay, so let's talk a little bit about what is incontinence and the different types, because I know that it can I don't know. I know there's two kinds. Anyone else want to take it from there?
Well, so incontinence means loss of bladder control or leaking urine is what we're going to talk about on this particular video. We'll talk about leaking poop on another one. So there are several types. There's actually 4 types. There are 2 super common ones, which you alluded to knowing, and that's what most people know. But Myra, since you listened to me asking patients, and you ask patients too, what their problem is, tell them about the most common type.
Okay, so the 2 most common types of incontinence are urge incontinence, where you cannot hold your pee whenever you gotta go to the bathroom. Like you have the
It's like you feel like you gotta go and then you run.
Yeah. And then some people don't make it. Yeah, and that's why they go and see her. They really can't make it to the bathroom. And then the other type is stress urinary incontinence, which is whenever you are leaking with any type of exertion. So like coughing, sneezing, exercising, jumping, like anything.
And
Even sex, yeah.
leaking with sex.
So
Oh wow.
those are the 2 main common ones, most common ones, and you can say that other
So,
ones go.
eventually, you probably think, well, you know, why are we talking about this? This doesn't pertain to me. I'm young and I'm probably not going to have kids. So
I'm young and I am at my peak.
So who cares? I don't want to talk about this. So there are actually sports that increase your risk for stress urinary incontinence.
Wow.
Can you think of some sport that might do that when she's talking about stress, meaning exertion type of exercise? So
Like track?
Yeah, like you're like
So,
running hurdles and all that. Like you're really exerting those muscles.
track running,
Volleyball. I don't know.
That's the
thinking
number one.
Woo!
Number
Really?
one sport.
Where's my prize?
No, the cameraman. Number one cause of stress urinary incontinence. That's a sport specific type is volleyball. So volleyball players really need to protect themselves. I have a young lady who's early 30s, and she's a volleyball player. She teaches her daughters who are late teens. They're also on volleyball teams, and the mom in particular, she's got it really bad. She leaks a copious amount every time she jumps or smacks the ball.
Oh wow.
So it's really critical that if you are going to do that sport, that you are super diligent in terms of doing the pelvic floor exercises. We talked about this before, the Kegel exercises, but also do it right before, if you can predict it, right before you're going to do a slam.
Right.
Or just like I mentioned other times, where the occupational therapist likes to say, squeeze before you sneeze. So squeeze before you're going to do whatever activity is going to potentially lead to
exertion.
leakage. Any kind of exertion.
So why is like volleyball at a higher risk than other sports?
Because they get a kind of a double whammy. They are grunting as they're going up, and then they grunt as they hit the ball. So it's pressure again placed on the bladder and the pelvic floor. So definitely don't stop doing
when
volleyball.
you're jumping and you fall, you're like impact on the
So-
pelvic
So
floor.
when you're going up, and then also when you're going down.
In their case, because they're exerting themselves significantly to jump, right? They jump up high, and then they exert themselves to hit the ball, or whatever motion they're doing. And then actually it's a triple whammy on the land.
Yeah.
So
Wow.
is there like a specific age group where this like begins, or can it just be like as early as like 19? for
Yes,
example?
oh absolutely. If you were playing volleyball at 12, the damage can potentially begin there.
Oh wow.
So I have a very good friend actually, she's a professor, and I did her stress incontinence surgery when she was in her mid-30s, and she's thin. She was a volleyball player. She teaches it now. She's doing great after surgery, but you know, she didn't know all these things, and her daughters also are volleyball players, so she's getting them to practice early. Yeah.
Prevention is key.
It really is. It really is.
Early prevention.
Yeah.
Early.
How early are we talking?
Lily's how old?
I know, yeah, I'm like, we need to like less time. Thank God we're in quarantine.
No volleyball for anyone.
Okay, so y'all said the two most common. So what are the
Other
two uncommon?
So there is overflow incontinence. When women do not empty their bladders fully for whatever the reason may be, then they will fill their bladders very quickly, and because they're not thinking that their bladders should be full that quickly, they tend to leak because there's just an overflow. Their bladder's just too full. That's an old term, but I like to use it because it really gives you a sense, a better understanding of what's happening. And then the fourth one is neurogenic bladder. So people that have neurologic disorders, for example, a spinal cord injury patient, it's because their nerve is no longer working. It no longer the brain send signals through the nerve to the bladder to then control the function there. So those are the four main ones. One thing I want to add on urge incontinence. So urge incontinence is kind of a sub-classification under overactive bladder. So gotta go, or I'm not gonna make it in time. So someone that has overactive bladder can have overactive bladder with incontinence or without incontinence. So it's both. So you can go pee all the time frequently and have that urgent desire to go, but you don't necessarily leak. So then there is overactive bladder that does leak.
And tell us, why is it even called overactive bladder?
Because, that's a good question, because they are going too often. There are some women that will go every 30 minutes. I mean, can you imagine 24 hours in a day? How often is that?
Too often.
No, too often. I don't have time for that.
Yeah, exactly. And so yes, overactive. Their bladder is just contracting all the time for whatever the cause. There are many causes. We won't go into that right now. But one thing that's super important to know about it is that overactive bladder is a disease of aging. So we all will get it. We will all get it if we get old enough. So we don't want to. So knowing that, you want to be preventative and do not only Kegel exercises, we'll talk about other preventative measures on another episode.
Okay. Well, that seems like a great place to end it. Thank you so much for watching. If you liked this video, please give it a thumbs up. And if you have any comments, questions, or concerns, please leave it in the comments below. All right, thanks for watching, guys.
Cheers.
Woo! Incontinence.
No incontinence.
No, we got it.
Yeah.
Hey, and men get over